Angela Harris, E-Media Development Specialist with the News, here today with News and Legislation Editor Herb Warple. We're here to talk about the Patient Protection and Affordable Care Act and its potential effect on HVAC contractors. Herb, why don't you share with us how you feel this issue could positively impact small business owners?
Thanks, Angela. Well, beginning in 2014, companies that employ 50 or more individuals will be forced to sponsor a health plan for all of their workers. Employers who refuse to provide insurance coverage will be forced to pony up $2,000 per employee applied to all but the first 30 full-time employees. Luckily, most HVAC contracting businesses are very small, and according to a 2005 Service Roundtable study, 52% of all HVAC contractors with a payroll employ only 1 to 4 individuals. 22% employ 5 to 9, 14% 10 to 19 employees, and 10% between 20 and 99 employees. Only 2% really have more than 100 employees on payroll. Therefore, according to the study, 88% or more of HVACR contractors employ 20 or fewer employees. So, almost 9 out of 10 contractors will not be required to offer the health insurance, and they will not be penalized for not doing so. Additionally, if they do offer the coverage, they may be eligible for a tax rebate that refunds up to half of their costs.
You know, that all sounds great, but what about those companies that, employ more than 50 individuals? Many small businesses are regularly concerned about cash flow, and now the government is requiring companies to pay up. Employers with 50 to 199 employees can either provide the health care coverage or pay a tax penalty of $2,000 per employee, applied to all but the first 30 payroll employees. So a company with 50 employees is suddenly faced with a $40,000 fine or the option of implementing federally mandated health care that, according to the Kaiser Foundation, will likely cost more than $4,500 per employee. And that's a pretty big number. Numbers aren't the only snafu our industry is going to run into with this new healthcare system. Hercules Industries, a Denver-based HVAC manufacturer and distributor, has challenged the federal government on the premise that the new plan violates its constitutional right to free religion. The Newland family, which owns Hercules Industries, are devout Catholics, and prior to these health care laws, they offered a health insurance package that prohibited the use of contraceptives. Under the current requirements, the company is mandated to include all Food and Drug Administration approved contraceptives in their plan. The family very strongly disagrees with this requirement and filed a lawsuit based on this premise.
Yeah, we're all interested to see what happens with the Hercules Industries case, as it could have implications that stretch beyond the HVAC industry. But despite some problems with the healthcare mandate, it's really hard to ignore that many bright points do exist. Take, for example, its immediacy and its availability. Beginning in 2014, all citizens will gain insurance immediately with no waiting period. Additionally, insurance companies will no longer be allowed to exclude individuals for carrying pre-existing conditions. In fact, the Affordable Care Act is designed to help small businesses by curtailing the skyrocketing costs of providing coverage to employees. In addition to affordable coverage access for existing small businesses, this health care reform could also be a boon to aspiring entrepreneurs. The measure is gaining small business support as well, and according to an opinion poll recently released by the Small Business Majority, over half of 800 small business owners polled supported the Affordable Care Act.
You know, that may all be very true, Herb, and some of it sounds really great, but the measure still isn't that popular with the overall population masses. A recent Rasmussen Report national telephone survey revealed that 55% of likely U.S. voters at least somewhat favor a repeal of the health care law, with 41% saying that they strongly favor that repeal. 39% are thinking that the law should stay and they oppose repeal, and 30% of those are strongly opposed on the other side. You know, it's obvious that there are many different opinions on the United States national health care model, and its eventual impact on HVAC contractors is going to continue to be an interesting story for us to follow. As always, for more information on these issues and many others affecting HVAC contractors, visit www.achrnews.com.